Good evening, everyone. Thank you for coming today, our pitch session. Now, I am a last pitch presenter, Dr. Taoka at the University of Tokyo University Hospital. 20 years old, I am a hematologist, and I conduct first bone marrow transplantation with a patient with leukemia. The transplantation had been succeeded, but the patient had a fever and progressed to sepsis. Sepsis is high case. The patient passed away just 7 days later. If I had been able to diagnose sepsis sooner, I had saved the patient. This story is the beginning in my innovation. What is sepsis? Sepsis, in Japanese, high case. When the patient has a fever, it is difficult to diagnose between the simple fever infection and the sepsis. Once the bacteria enters the bloodstream, this leads to the septic shock and cause to the organ dysfunction, and finally result in the possibility to death. Sepsis is a global emergency. Global death rate is 20 to 60%. And sepsis, surprisingly, sepsis death exceeds those of major cancers. I'm surprised. The main problem is time to diagnose sepsis. Look at the figure. The 6-hour delay diagnosis can push the mortality near the 60%. Death is 6%. The treatment is already known, antibiotic treatment and fluid infusion. If we diagnose sepsis early, we can save lives of the patient. Until now, no one had thought that pathway form was related to sepsis. Me and our team, a breakthrough idea reveals the relationship between the sepsis and pathway changes. This is the way I change myself, a new way of thinking. This is a solution. This is our device. New device detects a distinct pathway form change immediately in just 15 seconds. Until now, the standard method is blood culture. Blood culture needs a blood test and needs 2 to 4 days. It is too late to be useful to sepsis diagnosis. A device strong point is a non-invasive and no blood test. And sepsis can diagnose only in 15 seconds. The market size is global. Suspected patient, 200 million worldwide, and 15 million deaths. The term is $15 billion. 5兆円市場です。Now I am planning to do the international project and do clinical trial in PMDA in Japan, and next, the clinical trial also in the United States, and sells the medical device in the world. Now, in our team, I am majored medical, and Tokyo University, Yokota and Tagawa sensei majored in the technology. And I have already the global network belonging to the JETRO program with National University of Singapore. Singapore is a hub to the East Asia. And the GTI program, I joined San Diego and collaborated with the University of California. 最後に少し私日本語母国語の日本語でちょっと思いを述べさせてください。この話っていうのは私の本当に経験の一番最初の患者さんで起こったことなんですけど、実はそれは3秒に1秒起こったことです。こういったデバイスができるとですね、日本のみならず世界の以前からの課題なので、その医療の課題っていうのが世界規模で解決できるんじゃないかというふうに考えています。そして今もチームビルディングしているところですので、今日高校生も来てたりですね、大学の人たちもいますし、先生方とか企業の方とかおられますけども、もし何か協力したいという人がいましたら、ぜひお声かけください。で最後に、私の感謝の言葉なんですけども、私このダイバーシティっていうのを、よく聞くんですけど、そういうことを、自認はしてませんでした。で今回トゥベルに参加させていただいて、まさにこのフェローの仲間たちと、一緒にさせていただいて、本当に仲間に入れてくれたっていう感じがして、本当に感謝しています。これも橋寺さんとか飯島さんの影響がものすごくこのトゥベルは大きいなと感じているんですけど、本当にサンキューベリーマッチということでお願いしたいと思います。どうもありがとうございました。